in Brasília. I work with neuropsychology for about almost 20 years now. And after a while, maybe after 10 years of clinics, I came up with the biofeedback as a resource to apply with my patients. And I started to study and got very interested in how does it work physically, and how does it work psychologically. And at the end, I came up with a very nice research that I will present to you about cognitive aging. But first of all, I will just talk about what is the biofeedback. Because the biofeedback is an operant condition of the physiological state. But most of that, what does it mean? What does it mean to be an operant condition of the physiological state? So it's the ability that we have to self-regulate our own state. That's it. When we are doing the operant conditioning, most of the time, the behavior that we are being able to repeat in our life, it's not always a conscious behavior. Sometimes we just do something and we have like a feedback, could be a positive one or a negative one. And this feedback will make us conduct this again or not. Consequently, we start to have a lot of behaviors that most of the time conditioned in this kind of way, which we call operant condition. But most of it, when we say about the biofeedback, we have also a cognitive approach. We are not only, when we start to self-regulate our state of mind and our physiological state, most of the time we became aware of this. And as we became aware of this, we are able to process the feeling and the sensations that we are having cognitively as well. So it's not only unconscious. There is a part of the biofeedback that's conscious, that is knowledge, that is understanding. So how does it work? Most of the time when we are using the biofeedback, the principle that is happening is that we have a technological equipment. Most of the time is a computer, and we have some kind of a sensor, something that can provide the information about our physiological state, which can be the respiration, the heart rate, the brain waves, the temperature. And with that, the computer gives us the feedback when we change our state. So if I have in the respiration rate very fast and I need to calm and have my respiration much more, to lower my respiration rate and get comfortable with it, I will have the feedback from the computer. So it's not just capture our physiological state. It's necessary that I have some feedback of the computer to tell me that I am in the right direction. I will talk about some of the modalities and the application. Most of these modalities and application that I will say it's applied in psychology. It's not only psychology, but it's applying psychology. We can have biofeedback also in workers, in medicine and in physiotherapy, to work with muscles and contractions. But here I will just talk about the applications in in psychology. So the first equipment that we have, it was the Galvanic skin response that it was developed in the 60s, around 60s and 70s. Very simple equipment. The sensor just captured our sweat in the tip of our fingers, and the amount of sweat is completely connected with the sympathetic system and the stress situation. So if I have a higher amount of sweat in my hands, probably I am much more activated in my sympathetic system. So I'm much more stressed than when I have my hands not sweating. So most of the training, the galvanic skin response, is to decrease the amount of sweat at the hands. So consequently, you will decrease the stress in your body. It's a bottom-up mechanism, we can say that, because I am taking the consequence, which is the sweat, of my body, of my stress response, and controlling it to have a better response inside my body. So it's a bottom-up mechanism. Most of the time we work with a higher pitched sound when I have an increased amount of sweat. If I want to decrease it, I will hear the bass sound. You can ask, so how can I do that? How can I know that? That's the operant conditioning part. You will have the response of the computer, and then you will manage the returning of the computer to you until you got the right response. So it's that's the behavior part. And then when you got the right response, you will feel comfortable, you will feel less stressful, and consequently you will enjoy this feeling and get strategies to continue this. So we have transfer when we work with biofeedback. Another modality that we have is the respiratory and heart rate variability. This kind of training, it's very good to manage stress as well. So the respiratory and heart rate variability, usually we'll use the frequency rate of your respiration and the frequency rate of your heart rate. So what happens is when you balance your respiratory rate with your heart rate, you feel comfortable. You start to diminish your sympathetic response. Most of the time, when we are having a very fast respiration, what happens is that the balance between the sympathetic and the parasympathetic system became compromised, and most of the time this will lead to a more sympathetic response. So in order to diminish the sympathetic response, we must exhale much more lower, in a lower time, with more timing to exhale than to inhale. And this frequency will get close to the rhythm of your heart. And this synchronicity that you experience will increase the amplitude of your beats, of your heartbeats, which will prepare you to deal with or manage much more stressful situations. And moreover, will increase the amount of well-being, the feeling of well-being. It's a very interesting training. And the neurofeedback, which is the regulation of the brainwaves activity using a technological interface. that feedback the individual about their own neurophysiological activity. We have another kinds of neurofeedback. Nowadays, they are starting to use the fMRI, and with very good results, with minimal sessions. However, it's much more, how can I say that? It's much more difficult to execute because you need the hospital to conduct the experiment, and using the EEG, it's very practical. We have EEG equipment that can go anywhere, so it's much more easy to conduct an experiment, and it's much more also studied. So the neurofeedback based on the EEG activity, which is the brain waves, exists since the 70s. So we have much more studies that are presented about it. So it's more efficient and accurate. So some of the examples of the application of biofeedback in psychology is to manage its stress and anxious patients that I told about it in the galvanic skin response, in the protocols of HRV, and neurofeedback alpha training. We also manage hyperactivity and attentional deficits in children with ADHD using an SMR protocol. We have the depression protocol to balance the interhemispheric difference applied frontally in the cortex, developed by Hammond. The SMRI, which is the sensory motor rhythm, is a protocol to improve attention and diminish the hyperactivity in ADHD individuals. We also use this protocol to improve and enhance performance, cognitive performance, and that's the study that I will talk about that I conducted in the laboratory at the University of Brasília. We conduct a study with older individuals expecting to improve their working memory, because as the individuals grow older, we experience difficulties in attention, working memory, episodic memory, as well in executive functions. And most of these alterations that we experience happens because we have differences in our brain. So our brain changes over time. And consequently, we need to develop tools to improve these and improve the cognitive function in this aging population, especially because we have a very long lifespan nowadays. So the cognitive training use older adults. We have some studies. The cognitive training, it's a tendency that we hear about it since the 80s. We have the behavioral ones with games, but now we are starting to use the neuromodulation with neurofeedback. So we started to have much more studies about it, but it's not a lot. And these studies have shown a lot of interesting results of the neuromodulation being applied as a cognitive training to provide reserve to these individuals. So we try to use the neurofeedback to improve working memory performance in this population. We conduct this study with 70 healthy elderly to increase the SMRI, which is the training of the sensory motor rhythm in the central area of the brain. We conducted this in 10 sessions, And the assumption that we have is that why we use a protocol that improves attention to test working memory is because on the model of Bedley and Hitch of working memory, the central executive holds a lot of attention to keep the information in line in order to be used. So the working memory model required a lot of attention. So we conclude that the SMRI training should be a good training to this, to improve the working memory, consequently the executive function of these individuals. It was an experimental placebo randomized study. We divided in 3 groups, so the neurofeedback group, the non-neurofeedback group, and the placebo group. We conduct also an EEG during the working memory task, before the training and after the training to check the cortical changes. So the task that we required them to do, it was a delay match to sample, which was a visual working memory task where the subject must choose the same picture that they saw before. We use a very long delay of 50 seconds between expositions, because when we are dealing with working memory, visual working memory, we have to try to decline the attentional process, so diminish the online information that it's in your head to test if the test was good enough to measure in the repeated measures, because we need to check if they improve the working memory afterwards. So we didn't want a ceiling effect. The training was in the central area, in the sensory motor cortex, and it was to improve the sensory motor rhythm, which is a frequency of between 15 and 17 hertz. So the individuals must increase this frequency range in 10% of their normal, of their standard or their normal pattern. So we did the pre-training. At the pre-training, the individual did some tests, some neuropsychological tests, some behavior tests about anxiety and depression. We conduct the DMTS, as well as EEG or quantitative EEG. The training was at the lab, so it was 10 sessions. Neurofeedback training twice a week. So they came to the laboratory for about 2 months. And the placebo group, they conduct the first session as a real one, and the other 9 sessions, it was just a repetition of the first session that they have. So the results that we got was very promising, because actually they improved their working memory performance at the neurofeedback group comparing to the placebo group and the control group. But most interesting, it was that the placebo group also have an improvement in their performance, but not as good as the neurofeedback group, but they also improved. So what we have is that the neurofeedback actually facilitates the attentional process, and that's very critical for a good performance in the working memory test. And moreover, we have this improvement in working memory that does not only occur because of the neurofeedback, but also because the experience of being at the lab and doing the neurofeedback and wanting to get better, they also improve their performance. So the exposition to the techniques, it's enough to improve it. It's not as good as the real one, of course, but the placebo group also have some reward, let's say. So it was very good for them. When we checked the EEG, we saw that comparing the pre and post training, we observe a higher activity between the pre and post training, especially in the areas that are required or during the working memory tests, which is frontally and centrally, mainly in alpha and theta band. And another result that was very interesting is because we have differences in activation between the neurofeedback and the placebo group. So the neurofeedback group, they have a better performance afterwards, but they didn't had to require so much of their brain. So they didn't have to erase their brain activity in order to get the results. What does it mean? It means that when we are talking about the brain, we have the brain requires a lot of energy of us. So most of the time, the brain is always trying to become efficient. So when we got things that when we got the plasticity, when we reach a network and we can confirm this network, most of the time we will not require as much energy that we used to require because this pathway is already established. So that's what happened with the group of the neurofeedback. The sham neurofeedback, the placebo group, has a higher activation between training. So in order to keep the performance or improve the performance, because that's the point of the study, they have to require much more of their brains, which is in accordance with the crunch model, which is a model that says that the older people tend to, in order to keep their performance, they tend to enhance their brain activity. And when we got the neurofeedback group that didn't have to enhance their activity, but got a better performance, so then we have a very nice result in the understanding the importance of the neurofeedback to provide a cognitive reserve. So to conclude, the training presented has the aim to demonstrate how neurofeedback might improve working memory and benefit the cognitive reserve in age population. And the biofeedback is an important tool to improve the self-regulation, not only in clinical population, but also in a healthy population, because it helps to prevent cognitive decline. It helps the person to have personal awareness. And in the clinical population, it's a very efficient tool to manage the anxiety and symptoms that sometimes makes the individual very uncomfortable. And it can, even when as a therapist, as a psychotherapist, when the person is very activated in their symptoms, sometimes it's hard to work with them. So when you have a tool like the biofeedback, we can manage this, we can calm down this person, and then we can work with her more cognitively and understand what's happened with the person. So that's it. That's what I want to say to you. Thank you.